And new at 6, patients and researchers calling it the first step towards a true cure for type 1 diabetes in 100 years. A recent clinical trial using stem cells allowed patients to survive without insulin injections. Courtney Friedman spoke to a leader from the organization funding this study who also lives with type 1 diabetes.
Alan Lowry was diagnosed with type 1 diabetes when he was 6, a year after his twin brother.
It's an autoimmune disease where my immune system thinks that my pancreas is something bad, so it attacks it, and now it doesn't produce insulin anymore.
So he has to inject it through syringes or an insulin pump.
I'm like one miscalculation away from a really serious emergency. Cells don't have the energy they need to function, your organs start turning off, your brain, your lungs, your heart.
In 2015, he became a board member at 𝘗𝘂𝘀𝑟𝑓, a national nonprofit funding research for type 1 diabetes and offering a support system for patients and their families. Recently, 𝘗𝘂𝘂𝑟𝑓 helped fund a clinical study using stem cells that they call the biggest advancement for type 1 diabetes in 100 years, since the very first insulin injection treatment.
It took donated stem cells and it injected them into someone's body. And what that did allowed a type 1 diabetic to live with a 91% insulin-free regimen.
When asked what this means for people like him, visible joy and relief.
Oh gosh, there's so many possibilities. This is the first large step towards an actual practical cure where someone with diabetes could live the same life as someone without diabetes.
The stem cell research is still in its early stages. There's a lot of work to do, more clinical trials, more data to be collected, but there's also more hope than ever. Courtney Friedman, KSAT 12 News.